Well, good afternoon, everyone, and welcome back to our daily briefing. We're going to begin today with our daily medical update from Dr. Ezike. Doctor?
Good afternoon. We're going to talk about testing. Testing is one of the keys to reopening the state, which is why we are working diligently to expand testing through public-private partnerships. I thank the governor for working tirelessly to bring the necessary equipment and supplies for testing here to Illinois. Testing leads to quick identification of cases, quick treatment for those people who are identified as positive, and immediate isolation of individuals that will help prevent spread. More readily available testing will also help us determine if close contacts to the confirmed cases have been infected. Testing is also important for the bigger public health picture so we can hone our mitigation efforts, do targeted interventions, and learn more about how the virus is spreading and to whom. Knowing who is infected is critically important, which is why we are asking everyone who is tested to make sure they fill out the information on the form completely. The form asks for important information such as age, gender, race, ethnicity, county of residence, occupation, the clinical history surrounding your situation, recovery and exposure information. Gathering this information helps inform our strategy, helps us to understand who is getting affected and in what areas of the state. It helps us to stop spread and provide support and assistance to communities that are identified as needing it most. People who can be tested includes anyone who has symptoms like fever or shortness of breath, chills, loss of taste, loss of smell, sore throat, but also without symptoms if you work in a healthcare facility, if you work in a nursing home, if you work in a correctional facility like a jail or a prison. Added to that are the first responders, whether paramedics, EMTs, firefighters, law enforcement, people who support our critical infrastructure, such as grocery store workers, people who work in pharmacies, restaurants, gas stations, public utilities, childcare, and sanitation workers. We also are including those who have underlying health conditions, and in the near future, as we start to think about elective surgery, those who are having elective surgery. Again, testing and comprehensive information will help us end this pandemic sooner. Regarding our numbers here in Illinois, we are reporting 2,563 new cases of COVID-19 here in Illinois, for a total of 52,918 cases. This includes, unfortunately, 2,355 lives lost here in Illinois, of which 141 were reported in the last 24 hours. To date, we have run a total of 269,867 tests for COVID-19, with 13,200 being performed in the last 24 hours. As of yesterday, 4,953 individuals in Illinois were reported to be in the hospital with COVID-19. Of those, 1,289 patients were in the ICU and 785 patients were on ventilators. As we further ramp up testing, we need to remember that we all must continue to stay home as much as we can, to wear masks and social distance if we do have to go out, and to wash our hands frequently. This will continue to work as we remain all in for Illinois. Thank you, and now I will summarize comments in Spanish. Buenas tardes. Yo quiero hablar sobre las pruebas. Las pruebas son una de las claves para reabrir el Estado. Por eso estamos trabajando para expandir las pruebas a través de asociaciones públicos-privadas. Agradezco al gobernador por trabajar día y noche para traer el equipo necesario para hacer más pruebas en Illinois. Las pruebas manejan la identificación de casos rápidamente, tratamiento rápido para personas que son positivas y aislamiento inmediato de las personas que ayudará a prevenir la propagación. Las pruebas más fácilmente disponibles también nos ayudará a determinar si han infectado los contactos cercanos a casos confirmados. Sabiendo quién está infectado también es muy importante. Es por eso que estamos pidiendo a todos los examinandos que completan toda la información en las formas. Las formas solicitan información sobre edad, sexo, raza y etnicidad, condado de residencia, ocupación, historia médica, recuperación y información sobre exposición. Colectar esta información ayuda a informar nuestras estrategias para ayudar a detener la transmisión y traer apoyo y asistencia a las comunidades que más lo necesitan. Las personas que pueden hacerse la prueba incluyen gente que tenga síntomas como fiebre, dificultad a respirar, escalofríos, pérdida de sabor o pérdida de oler y dolor de garganta, pero también la gente que no tenga síntomas y trabaja en un centro médico o correccional como un cárcel o una prisión. Los primeros responderos como paramédicos, policía y bomberos, también personas que trabajan en lugares esenciales como supermercados, farmacias, restaurantes, estaciones de servicio, servicios públicos, cuidado de niños y otros más. También los individuos que van a tener cirugía electiva va a comenzar en unas semanas. Y gente con condiciones de salud subyacentes. Una vez más, las pruebas y la información completa nos ayudará a poner fin a esta pandemia. Hoy estamos reportando 2,563 nuevos casos de COVID-19 en Illinois para un total de 52,918 casos. Esto incluye un total de 2,355 muertes, de las cuales 141 fueron reportadas desde ayer. Hasta la fecha, hemos realizado un total de 269,867 pruebas para COVID-19, con 13,200 realizadas en las últimas 24 horas. Desde ayer había 4,953 personas en Illinois estaban en el hospital con COVID-19 y de ellos 1,289 pacientes estaban en la unidad de cuidados intensivos y 785 pacientes estaban en ventiladores. A medida que avanzamos en las pruebas, debemos recordar que todos debemos seguir en casa todo lo posible, usar máscaras y distancia social si tenemos que salir, y lavarnos las manos con frecuencia. Esto solo funciona si estamos trabajando juntos. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you. Well, testing, tracing, and PPE are key to our ability to reopen our economy and keep people safe. That's why you've heard me talk so much about them so often. Today, I want to focus on testing, and I'm proud to be joined by Jose Sanchez, the president and CEO of Norwegian American Hospital, who's been a wonderful partner in expanding testing access in some of our most impacted communities. Last Friday, when I gave my last update on testing, we had just marked the first day that we'd passed our first major milestone of 10,000 tests per day, a number that we've continued to meet every day since, including today, with 13,200 tests in Illinois over the last 24 hours. Accomplishing a goal of expanding testing involves much more than just a machine to run tests. A lab needs the raw materials that are necessary to sustain and increase our testing output. And when this pandemic hit the United States, it became immediately evident that our nation just doesn't produce enough of these raw materials to meet the medical need. With limited assistance from the federal government, Illinois had to do something it has never done before: aggressively assemble supply chains to acquire the needed materials, such as testing swabs, to allow us to take a specimen from you, and such as viral transport medium, or VTM, to allow that sample to be transported safely to a laboratory, and reagents, which are the chemicals that allow a testing machine to actually run the tests. When we began, all three of those raw materials were in extreme shortage across the world. Our procurement teams have been hard at work competing for those raw materials against every nation and every state in the open market. And so far, we're succeeding. Our research universities developed our own VTM, which is relieving pressure to acquire it on the open market. And we've acquired swabs using sometimes aggressive tactics to beat out our competitors. As of yesterday, I'm pleased to announce the White House has promised Illinois 620,000 individual swabs and 465,000 vials of VTM, which will be delivered beginning in the first week of May. As we've worked to expand testing, we've made it a priority to partner directly with organizations to test people in many communities across the state. We're working with trusted establishments such as community health centers and hospitals to reach our most vulnerable residents. We've increased the number of public testing sites to 177 across the state. That's up from 112 sites last Friday. Tests at these locations are entirely free, and they're available in every region of the state. I'll announce them by IDPH region here, as I did last week, but you can always go on our website, coronavirus.illinois.gov, and explore our interactive map of testing sites to find the one that's closest to you. The sites are 19 sites in the Rockford region, 9 sites in the Peoria region, 8 sites in the Springfield region, 5 sites in the Edwardsville region, 33 sites in the Marion region, 10 sites in the Champaign region, and in Cook County and the Collier counties, 41 sites in the city of Chicago, 22 sites in the southwest suburbs, 8 sites in the west suburbs, 11 sites in the northwest suburbs, and 11 sites in the north suburbs. More partner hospitals, clinics, and federally qualified health centers are coming online all the time. And I'm proud to announce that we will be adding 2 new drive-through testing locations, bringing our state-run drive-through facilities to 7. In addition to our existing locations in Markham, Bloomington, Harwood Heights, Rockford, and Aurora, the 2 new drive-through sites in Waukegan and in East St. Louis will be open next week. Rockford and Aurora, our most recent additions, have been running only since the end of last week, and they've already been an incredible success, averaging about 1,000 specimens a day between the 2 sites. And we hope to get similar results from our East St. Louis and Waukegan sites when they come online, with a goal of bringing our drive-through testing capacity to over 3,000 specimens per day. My team and I continue to consult with health experts and communities to determine additional drive-through locations around the state, and I look forward to sharing with you our future updates on this work as soon as we have those sites ready to go. I know that these past 2 months have probably felt like a crash course in new terminology and techniques. But as you likely know by now, testing is vital to our efforts to reduce social restrictions, get our economy going, and to protect our residents. With a modified stay-at-home order beginning tomorrow, I want to briefly touch on the changes that continue those efforts to move toward opening up, giving Illinoisans more flexibility where it is safe to do so. Starting tomorrow, retail stores can reopen by taking orders online and over the phone and offering pickup and delivery. Greenhouses and garden centers will be opening with specified social distancing measures in place. Many of our state parks will be open and many golf courses will open with strict social distancing measures in place. And elective surgeries that have been put off due to the crisis can now be scheduled in surgery centers and hospitals in compliance with IDPH guidance. As we open things up and make progress, tomorrow will be the first day where adults and any children over the age of 2 and everyone medically able to tolerate a face covering will be required to wear one in any public place where they can't maintain a 6-foot social distance. All these changes represent a shift in our approach to COVID-19, a shift made possible by the millions of Illinoisans who have stepped up by staying home and keeping each other safe. To the vast, vast majority of you who believe in the power of being all in for your communities, thank you. Thank you for all that you've done and all that you continue to do. It truly makes me proud of the people of our state. So thank you, and now I'd like to turn it over to one of our terrific healthcare partners on the front lines with us in this fight, Jose Sanchez, the President and CEO of Norwegian American Hospital.
Good afternoon, and thank you, Governor J.B. Pritzker, Deputy Governor Sol Flores, Dr. Ezeki, for the opportunity to participate in this press conference. For over 125 years, Norwegian American Hospital has been an integral part of the Humboldt Park community, which includes Puerto Ricans, Mexicans, as well as individuals from a variety of multicultural backgrounds. We provide excellent, compassionate health care, and it has been a privilege to lead that institution for the last 10 years. Our Humboldt Park community is rich in cultural diversity, struggle with poverty, substance use disorders, diabetes, cancer, heart disease, lack of some basic needs. Additionally, crowded housing is common, more than twice as likely compared to other neighborhoods in our city here. Norwegian American Hospital continues to play a vital role battling COVID-19, and we are proud to have launched drive-through testing this week to address these serious health inequities we have seen in our community. We have partnered with Rincon Family Services, Vida Sida, and the Puerto Rican Cultural Center. Thanks to the outstanding leadership and support of Governor J.B. Pritzker and Deputy Governor Sol Flores, we were able to acquire testing kits for our community. We have received overwhelming response and number of requests for testing, and we are pleased to lead this effort in Humboldt Park on the west side of our city. By the end of this week, we will have completed hundreds of tests. Due to the health inequities, it is critical that we identify individuals that have COVID-19 early so we can provide interventions and prevent the spread of virus in our underserved communities. Our Latino and African American community have significant comorbidities such as diabetes, cancer, heart disease, and lack of basic needs. This put them most at risk of dying. To date, over 80% of those we have tested are Latino and African American, and half have tested positive. We want to continue to address these serious health needs and expand our testing capacity. Thank you, Governor, for addressing these inequities in our community. And now I would like to go into my Spanish. Buenas tardes. Gracias al gobernador J.B. Pritzker, la vicegobernadora Sol Flores, doctor Ezeki, por estar darme una oportunidad de participar en esta conferencia de prensa. Durante más de 125 años, Norwegian American Hospital ha sido una parte integral de la comunidad de Humboldt Park, que incluye puertorriqueños, mexicanos y gran diversidad de orígenes multiculturales. Ha sido siempre un privilegio brindar atención médica excelente y compasiva. Nuestra comunidad de Humboldt Park es rica en diversidad cultural, pero lucha con la pobreza, trastorno de adicción, diabetes, cáncer, enfermedades cardíacas y necesidades básicas. Asimismo, la mayoría de las personas en la comunidad habitan en viviendas sobrepobladas en comparación con otro vecindario de la ciudad de Chicago. Norwegian American Hospital sigue desempeñando un papel vital en la lucha contra el COVID-19 y estamos orgullosos de haber comenzado a realizar pruebas esta semana desde sus autos para abordar la grave inigualdad en salud que hemos visto en nuestra comunidad. Nos hemos asociado con Rincón Family Service, Vida Sida y the Puerto Rican Cultural Center. Gracias al excelente liderazgo y apoyo del gobernador J.B. Pritzker y la subvicegobernadora Sol Flores, pudimos adquirir los suministros necesarios para realizar estas pruebas. Hemos recibido una respuesta muy positiva de los residentes de nuestra comunidad de Humboldt Park. Al final de nuestra semana, habremos completado cientos de pruebas. Debido a la inigualdad en salud, es imprescindible identificar lo más pronto posible la cantidad de personas infectadas con el COVID-19 para poder proporcionarle intervención médica y prevenir la propagación en nuestras comunidades deshabitadas. Hasta la fecha, más de 80% de lo que hemos examinado son latinos o afroamericanos y la mitad han dado positivos. Queremos continuar nuestras graves necesidades, enfrentando nuestras graves necesidades. Gracias al gobernador por su ayuda en la desigualdad y necesidades que existen en nuestra comunidad. Les deseo a todos mucha salud. Gracias.
Thank you very much. Happy to take any questions.
Okay, Governor, I've tried to clump them into subject
Great.
areas.
Thanks, Dan.
So first, question from Craig Wall and also from Marianne Ahern. Can you respond to the federal lawsuit filed by the Western Illinois pastor claiming his First Amendment rights have been violated and that the governor appears hostile to churches by not allowing them to gather? He plans to hold services Sunday. What is your reaction to that?
Sure. Well, first of all, so many of the pastors and faith leaders across the state have been partners with us in working with their parishioners to make sure that they're staying at home and staying safe. And I've been grateful for their partnership in that. These are difficult times for parishioners and for those of us who worship to not be able to access sometimes in person your faith leader, especially as anxiety has come over people. Coronavirus is a very serious infection that's in the air. It's around us, and it's caused people to need that kind of counsel. Most faith leaders have found new ways to connect with their parishioners on Zoom conferencing, holding services by teleconference, and I would encourage people to continue to do that. And I would just urge the faith leaders, who are concerned about the length of this, to just put the health and safety of their congregants first. I think that's uppermost in everybody's mind. It's certainly uppermost in my mind. And I would have everybody focus on the fact that we're still climbing this ladder of hospitalizations and ICU beds being filled. And until we get to the other side, even according to President Trump's plan, we really can't begin to open up until we have 14 days of down cycle of those numbers. And so, we'll continue to work at that and make sure we do the right thing, following, the suggestion of the president's plan.
But reaction to the lawsuit specifically and the charges that his First Amendment rights are violated, and really how far will you go to enforce the stay-at-home if he says he's holding services Sunday?
We've asked everybody to do the right thing, and as I say, parishioners and their pastors really have done the right thing across the state. So, this person is, it's a bit of an outlier, but everybody has the right to sue. And, we've seen in multiple states now, people have filed lawsuits on various things having to do with the stay-at-home order. But we're going to keep doing what we need to do to keep people safe.
Well, to that, we'll stay in this general subject matter because there are a lot of questions about this. A question from Greg Bishop at Centered Square. Several counties have either a sheriff or a state's attorney saying they won't enforce your orders. Why should other counties think your orders are enforceable if other areas are refusing to enforce?
Again, I would point people to the fact that people are still getting infected. More and more people are ending up in the hospital, and more people are dying. We had 141 people die today, and not all of them were in Cook County or Chicago. Some of them were in downstate Illinois. And it's important for us just to pay attention to the fact that until we get to the other side of this, once again, I would point to President Trump's plan and their suggestion put together with national experts, that we really need to be extraordinarily careful until we begin to see those numbers subside.
But I have to follow up, and that is if people are starting to push back and saying, well, we're not going to enforce this, we're going to let people get away with going to church, for lack of a better phrase, by the way, those were my words. What are you going to instruct state police or enforce state's attorneys and district attorneys in various counties to double down, or no?
What I'm doubling down on is the fact that all the people who live in those counties are being put in harm's way by those who are putting gatherings together of any sort that are going to potentially infect others. And I'm doubling down on the idea that the health and safety of the people of those counties and of all across our state is at risk when people don't follow the recommendations of the scientists, the doctors, the epidemiologists who are telling us that until we see a subsidence of these hospitalizations, of infections, you heard there are more than 2,000, I think 2,500 infections detected today, and that's just a small fraction of those people who are in fact infected who don't know that they are because we haven't been able to test everybody. But we know that there are many, many people out there that are pre-symptomatic, asymptomatic, and yet have coronavirus. So if you put one of those people in a room full of parishioners, you run the risk that you're going to get a kind of exponential run of this disease, of this infection rather, through a crowd of people that you love and care for.
But I guess what I'm just directly asking is, on behalf of all these folks, is will there be repercussions if there is a blatant defiance in other counties of your stay-at-home order?
Nobody's going to, run in and break up a gathering of churchgoers at that moment. But I will tell you that there are consequences. Of course, the state has the ability to enforce orders, but we've been looking to people to do the right thing, and they should do the right thing. And I think the parishioners, by the way, ought to do the right thing and ask those who are faith leaders either not to hold those services or simply ask that they have something online that they can connect to rather than the potential for being infected.
Last question in this broad realm for now, and then I'm going to move on to another subject matter. This is from Amy Jacobson, who writes verbatim, "Smart public policy is not doing only what scientists say. You as the governor have the power to convene Illinois lawmakers, some who are not pleased with the 30-day extension. Don't you think other voices from around the state representing their constituents need to be heard as well? Does the legislative branch have any role to play in this crisis, or does the executive branch have total control?"
Well, if Amy had read the executive order, she would see that the legislature has the ability to meet. It is an essential, organization, and under the executive order. I know that it's very difficult, and I've said this multiple times, to get 177 members of the legislature plus their staffs together somewhere. That doesn't mean it can't be done. It just means it's extraordinarily difficult, especially with all the processes of the legislature. But this is something the legislators themselves will have to work out.
Moving on to another subject, at least for now. There's a series of questions about unemployment, several from my newsroom, my colleagues, several from other newsrooms. So I'll start broadly with questions from ABC 7. Every newsroom is still getting dozens of complaints from concerned people who are having trouble, in a lot of cases, simply getting online to certify, or who are hitting roadblock after.
Under the CARES Act was set aside for supplemental funding to help low-income families through the Low-Income Home Energy Assistance Program. This program specifically assists families in paying their utility companies throughout Missouri to stop disconnects and shutoffs related to COVID-19, ensuring that Missourians would not have disruptions in utility services in the face of an economic hardship. Further, under the direction of my administration, the Missouri Housing Development Corporation is working on guidance that will provide additional $9 million in rent assistance to individuals and families that have experienced an economic setback from COVID-19. And finally, on April the 1st, the Missouri Supreme Court and several judicial circuits announced that they would suspend or postpone proceedings that included eviction or foreclosure cases until May the 15th. Also, in addition to concerns and questions that have been coming up, we've also continued to get questions regarding schools, both K through 12 and higher education. And today, Commissioner Van Dieven and Commissioner Mulligan are here to give us an update. So first, I would like to ask Commissioner Van Dieven for an update on DESE. Margie?
Thank you, Governor Parson. Good afternoon. As we think purposefully about reopening the state of Missouri, we at the Department of Elementary and Secondary Education are learning how our team members transition to providing services while working remotely, and also looking ahead at what's to come in the next several months. You may be accustomed to hearing our department talk about K-12 education, and many are not aware that the agency also houses vocational rehabilitation and disability determination offices that provide critical services to so many Missourians. Over the last 8 weeks, our vocational rehabilitation team members have served well over 14,000 individuals with disabilities each day on average while working remotely. That's nearly 100% of their normal workload, and our disability determinations colleagues working remotely have processed over 13,000 cases in these last 8 weeks, and that's about 90% of the cases typically processed. The leaders and staff members in these programs have remained committed to providing uninterrupted services to their clients throughout this time of uncertainty. And now back to K-12 education. As I've shared each time that I've been at the podium over the last several weeks, I continue to be impressed by our school leaders, educators, and staff members for continuing to serve Missouri students, even though school buildings remain closed through the academic school year. We will see schools begin to wrap up remote learning in the coming weeks as school calendar end dates vary from district to district. Until then, schools are continuing to provide services to students, including remote learning and much-needed meals. We're proud to say that more than 1.3 million meals have been served by our schools across our great state during these extended school closures. Now, both Governor Parson and the State Board of Education recognize and reiterate the importance of celebrating our class of 2020. We have urged school leaders to think about creative ways to honor Missouri's graduating seniors and to celebrate their accomplishments, but in a way that protects public health and abides by social distancing protocols. This will look different for each district as graduating class size across Missouri's range from 2 students to nearly 2,000 students. We hope our seniors know how truly proud we are of them as they each take the next step into their future. Also, many people are wondering about what summer school will look like. Districts and charters are working to find the best solution they can for their students, families, and staff members. To help with that, our department issued guidance on summer school to our leaders last week. This guidance was informed by task force recommendations that emphasized scheduling flexibility to help accommodate these unique times, as well as establishing expectations for both remote and face-to-face summer learning opportunities. While summer school remains optional for most of our students, this may be a time that more families consider this opportunity for learning, given the extended building closures. Last but certainly not least, DESE is preparing to distribute millions of dollars from the CARES Act to our local schools in the coming weeks. Missouri schools will receive $117 million from the USDA to reimburse schools for meals served during these extended closures. Today, DESE team members are submitting the final necessary information to the U.S. Department of Education to receive the $208 million that Missouri is getting for the Elementary and Secondary Education School Emergency Relief Fund. Our agency is doing all that we can to prepare for the incoming funds so that we can get those much-needed dollars out to schools as quickly as possible. These funds will allow school leaders to address remote teaching and learning challenges and other important educational needs resulting from COVID-19. And finally, we look forward to working with the Governor's Office and the Department of Higher Education and Workforce Development in implementing the Governor's Emergency Education Relief Fund. Once again, thank you to the many school leaders, educators, and school support staff members, as well as our parents, grandparents, and guardians at home, who have worked tirelessly to ensure that our children continue to take part in educational opportunities during this time of uncertainty, and for continuing to do so in the coming weeks. Thank you.
Thank you, Margie. And let me just say this for DESE and for the teachers out there, the administrators, to go what we've gone through and to be prepared and do what they've done in some of the most unusual circumstances is pretty amazing. It's just another one of those reasons why Missouri's work ethic showcases every time we get into situations like that. So I want to thank the education, everybody involved in the education, to keep going what they've been able to educate those kids and being prepared. And also on a personal note, as a grandparent, I've got a granddaughter that's graduating in 2020, so I'm kind of rooting for those graduation dates to make sure they get an opportunity to get those diplomas in there. And I think sometimes she thinks I can do miracles, but again, I'll be working with DESE and the administration to see what we can do for those high school seniors on that. The other one that's here today, Commissioner Mulligan's here today, that will give us an update on higher education and workforce developments, which will be crucial to the opening phases of our state and the future in the months to come. So, Commissioner Mulligan.
Thank you very much. It's a pleasure to be here with you today. I want to talk about 5 major priorities that the Department of Higher Education and Workforce Development has focused on and will continue to focus on as we continue to move through this unusual set of circumstances. Our first and most immediate priority has been about immediate needs, so immediate workforce needs, immediate supply needs. Our colleges and universities have played a vital role in helping the state secure the PPE it needs to keep healthcare and other workers safe. Our colleges and universities have also been engaged in conversations about other ways to help in the crisis, sheltering the sick, providing housing for healthcare workers who can't go home. So the immediate response has been very, very full-hearted and has reflected a great deal of passion for service on the part of our colleges and universities. At the state level, we also have been really focused on making sure we have the workforce we need to respond to the unique needs that the current situation presents. And that would include examples like working with the University of Missouri and its extension and healthcare services to provide training to temporary healthcare workers who have worked in the alternate care sites around the state. We will also be helping recruit the workers needed for contact tracing as that becomes a more real part of every day of our lives. And so we're really grateful for the opportunity to meet these immediate needs. Other immediate needs that our colleges and universities have met has been supported by the CARES Act that the governor spoke about a little bit and Commissioner Vind even provided more information about. Our colleges and universities, both 2- and 4-year, public and private, have received funds that they've been able to use to help students directly. Half of the money that those institutions used had to be used for student help directly, and also to respond to other kinds of needs on campus as a result of COVID-19. And so that would include everything from setting up laptop libraries that students can use when they don't have access at home, to buying hotspots, to doing professional development around online education. So our colleges and universities have been very hard at work to make sure that their students' spring semesters can continue in a new format, but with instruction uninterrupted. We're also focusing on the future of the Department of Higher Education, so transitioning from the immediate crisis to thinking about what comes next. We know that economic recovery is going to be a topic at the front of everyone's minds, and we're looking forward to contributing to that conversation. Our priorities in this area are making sure that Missourians have an opportunity to skill up and get the help they need to get back to work, that students will get the support they need, not just in this spring semester, but over the summer, the fall, and beyond. And we also want to make sure that the public workforce system emerges from this crisis stronger, more resilient, and more accessible than it was at the beginning. And the same true for the higher education system. This is an opportunity to really rethink the way we do our business, and we're excited about this conversation. Last but not least, I would be remiss if I didn't mention that the last of our goals really focuses on making sure that as a department we emerge from this stronger, more cohesive, and better prepared for the next major disruption. I think like a lot of communities around the state, we have learned a lot about each other as we have shifted to remote work, but the thing that's been most clear, most consistently, is the passion with which the people who work for our department serve the citizens of the state of Missouri. They've been absolutely unrelenting, and I am grateful for the service they have provided. So please stay tuned. We're going to have a lot more to talk about in this space as the months progress, and thank you for being here today.
Zora, thank you very much. And also, as we go through this recovery process, that's going to be one of the, let's just say, I think they're all busy right now, my directors and commissioners, but we're going to be relying on that to get people back in the workforce, to get them back in those training programs are going to be critical to moving our economy forward. So Zora, thank you, and thank you for what all your team's doing over there. Let me also, Director Lindley Myers is also here today, give us an update on the Department of Commerce and Insurance. Director?
Thank you, Governor Parson. The Department of Commerce and Insurance provides regulatory oversight for the insurance, financial, and public utilities operating in Missouri, as well as the licensing of thousands of professionals who serve consumers. During the COVID-19 health crisis, we've been working closely with others in state government to remove regulatory barriers to allow for as many individuals to work in Missouri as are needed to help address the health and welfare of our citizens. We've waived a historic 114 statutes or regulations for 41 regulatory boards in our professional regulation division. Alone, we have filed or are in the process of filing 5 emergency rules related to COVID-19. These waivers have allowed us to broaden the scope and the number of healthcare workers who can provide services in Missouri. These waivers also allowed licensees to continue to operate by extending renewal deadlines or by temporarily waiving or relaxing some of the education requirements related to licensing or the renewal of a license. The department issued a bulletin that enabled us to temporarily offer resident insurance producer licenses for various lines of insurance to assist those for work in the industry, but also who was unable to complete the testing requirements while the testing centers have remained closed due to the state stay-at-home and social distancing orders. These temporary licensees must be sponsored by a licensed Missouri insurance producer, ensuring that their work is being reviewed and consumers are adequately protected. This temporary license allows individuals to start working, and to date, we have over 80 of these temporary licenses issued in Missouri. The Public Service Commission has also issued a multiple number of orders approving various utility requests related to COVID-19. These requests include waiver of tariff late fees, suspension of disconnections for non-payment, and waiver of reconnection fees. I'd like to thank Missouri investor-owned utilities that proactively requested the PSC to approve and waive the Commission's rules and company tariffs in order to offer relief to their customers during this pandemic. All of the major utilities, which includes electricity, gas, and water utilities in Missouri, requested approval to suspend disconnection for non-payment and to waive late payment fees and charges, helping Missourians to stay safely in their homes during this stay-at-home order. One of our primary responsibilities in the Department of Commerce and Insurance is to ensure the solvency and stability of the industries we regulate. This includes insurance companies and state-chartered financial institutions operating within Missouri. Overall, the insurance market will weather the storm. These companies regularly prepare and run scenarios for the worst as they plan for severe economic conditions. At this point, we've not had any reports of insurance company insolvency or liquidation. However, we continue to closely monitor the impact of COVID-19 for the current impact and future developments which may indicate actions needed to be taken on our part to protect our Missouri policyholders. We have regular discussions with our insurers and fellow regulators nationally and share information with each in a real-time basis. I've issued several bulletins during this time asking our insurance carriers operating within Missouri to waive cost sharing for COVID-19 related testing, office visits, urgent care visits, and emergency room visits. We have also encouraged the robust use of telehealth services in order to render care while maintaining social distancing. I would also like to commend the insurance carriers who proactively stepped up to provide various forms of relief to their policyholders at a time when they needed it most. Our financial institutions have all remained open in some capacity through the COVID-19 crisis to serve the needs of Missourians. Although most closed their lobbies in order to comply with social distances protocols, they continue to provide services through drive-through banking or by scheduled appointment. Our banks and credit unions are solid, with historically strong capital and loan loss reserves, and are well positioned to work with their customers, both consumer and commercial, in dealing with the effects of this crisis. I want to thank our financial institutions for their continuity of service throughout this time. The department works closely with both our state and federal partners to ensure that we continue to provide the greatest amount of latitude in helping Missouri consumers work through the many financial challenges they are now facing. I want to remind everyone that we're here to assist you by answering any questions or directing you to the appropriate resources should you have problems. You can always find information about through our consumer hotlines or more on our website at dci.mo.gov. And finally, I want to commend the exceptional service provided by our DCI staff and applaud their robust efforts during this pandemic. Thank you so much.
Laura, thank you very much. Thank you for what your department's doing. And as you was talking through the regulatory part of this, I think as of today, we've probably waived probably over 450 statutes, regulations, policy, that we've done. And I think one thing we're learning from that also, we hope the legislators pick that up in the time to come and maybe really think about maybe making sure a lot of those maybe or don't go back on the books. I know my directors get nervous when I say that, but the reality of it is we got a lot of regulations out there that's really sometimes hampers business. So with that, let me just finish up here. With May the 4th just a few days away, I want to remind Missourians how important it will be to continue social distancing throughout the reopening process. We must continue to prioritize the health and safety of our families, friends, and fellow Missourians. So remember, use common sense, and most importantly, follow the social distancing guidelines. We can do this, and we will succeed. Thank you, and God bless. Kelly, let's open it up for questions. Also, Dr. Randalls is here today. Director Carson's also here today on any updates you might from them. So, Kelly?
Okay. I want to start with Commissioner Van Diemen.
All right.
Do you have any questions for her? So, Commissioner Van Diemen, questions for her. Okay.
Hi, Commissioner Van Diemen. I know you said that you encourage school districts across the state to do different things to maintain social distancing. There are a number of school districts who are talking about doing in-person graduations. Do you have any reaction to that?
Yeah, I think that's really why I included the point that our class sizes look vastly different across the state. If you have a graduating class with 2 students, it might be very appropriate to be able to do that in person. 2,000 makes that quite challenging, and so districts are exploring lots of different opportunities, but the point for us is to make sure that we are recognizing that class of 2020. Some are talking about extending it into a later time into the year, and I think anything that we can do to support our school leaders in those decisions will be really important.
Hi, can you just clarify the money part that you talked about? You said 117 million is coming for meals, and then 208, is that separate?
That is. The 117 is coming from the U.S. Department of Agriculture, so USDA for school foods. And then the 208 million is coming through the CARES Act, and that's specifically to the elementary and secondary school relief fund.
And what will that pay for?
So 90% of those funds will be distributed through the Title I process to our school districts, our LEAs and charter schools directly. And I want to make this note, which might not mean a lot to some, but it certainly means a lot to our school leaders. They are distributed through title formulas, but they are not title dollars, which means they have a tremendous amount of flexibility. They're intended to really assist during this time of crisis for COVID-19.
What do you imagine it'll be spent on?
I think one of the big things that we're seeing right now, to be very clear, is this digital divide. Very concerned about the fact that the inequities that we're seeing for our students are exacerbated during this time of separation. And so we need to make sure that all students across the state have opportunity for success and have access to those resources. So that's one. There's a few others, a lot of different supplies, different travel routes, training for teachers, that's a big thing that we're hearing too. This is a very different way of doing business for our teachers, and so making sure they're fully equipped to be able to deliver in this mode.
There's been some conversation about schools possibly trying to start earlier in August despite the school start law. One, is that a serious possibility? And two, it may be something for the governor to address, but is the state possibly going to offer more per pupil funding for extended school years since students have missed essentially an entire quarter of school?
So I will say that school start date is certainly something that we're looking carefully at right now. And how it's written in legislation is that the State Board of Education does have the authority to waive that in extenuating circumstances. Some of you may recall the board denied request for that in March. They may revisit that in the May 12th meeting, so I'll be able to tell you more about that May the 12th. At this point, I think it's pretty clear we will not be seeing any additional funding for schools for the extended school year, although that might be an allowable cost through some of those care funds that are being distributed.
Hi, Commissioner. You mentioned the inequalities of education are kind of highlighted during this time. Some school districts going completely online, some not able to, doing fully packet learning. Is moving forward, is there anything that you are taking from this for the future, just as guidance to expand maybe broadband or educational opportunities for those rural?
Absolutely, and I want to say I really think we're going to see some big shifts in the way education is provided throughout our state, throughout our nation. I want to be clear, that doesn't mean going solely to online. I think one of the things that we have seen from our children, from our teachers, that absolute need to be with one another, the relationships, the components. But there are a lot of things that we can do outside of the classroom, and we're learning a tremendous amount through this. And I think our key priority is to again ensure that every child in this state has access to that high quality educational opportunity. Thanks. Thank you.
Hi, Commissioner.
Hi.
You mentioned that the department will be helping with recruiting for contact tracing. Did you mean, is that department workers that will be doing that tracing, or will you be recruiting outside people to do that?
Sure, we'll be recruiting outside. One of the things that's happened in this situation is a lot of people are working in things that are adjacent to their day job, but they're helping in ways that may be new. So we certainly will be working closely with the colleges and universities, schools of social work, and other kinds of professions that are closely related to contact tracing to recruit people to work in that occupation, and we'll also be working with other partners throughout state government. Thank you.
Yes.
Yeah, I don't know if this is for you or maybe the governor to answer. Forgive me for not knowing exactly the jurisdiction on this, but because the Defense Production Act was evoked to keep these meat packing plants open, are these folks available for any kind of workers' comp or special protections on the federal level if they get sick?
I'll pass that on to the governor.
Okay, well, I do have one for him. Well, go ahead.
We ready? All right. Now the question was on the workers' comp on the people in the meat processing?
Yes.
Is that what it was?
Yes, if they get sick or ill, are they allowed any special protections under the Federal Government Production Act or because of evoking that act?
You know, I don't know. I would have to really look at that and see what the guidance of that is. But my guess would you be treated like any other employee any other time. Basically, that's just saying those businesses have got to stay open. We got to keep the food chains moving, is what that guidance was. But I don't know the exact guidelines of that. But I would assume it would fall under anything that you're on the workforce that you may have, as whether it's an injury or whatever it might be.
So that could still possibly qualify as normal workers' comp?
Yeah, I would think so. Whatever cause would do that. But again, you're talking about the coronavirus that's been here for 50 days that we know of, much like other symptoms. So I'm not sure what the federal guidelines are of that. I just have to look and see.
Okay.
All right. Okay.
Governor, as May 4th is soon approaching and businesses will be opening, is there any guidance the state is providing for workers who don't feel safe returning to work or don't feel comfortable?
Well, I think the one thing is, you know, when we open the state up, if they got to go back to work, if their boss calls you and the business owners calls you, go back to work, you got to go back to work. If you don't feel safe about going to work, you always have the individual right to stay home as an individual, just like you would in today, when you decide to go to work. But look, these businesses are going to go back up, and the employees that are going to go there are going to have to go back to work. And I think that's one of the things that, as we move forward, I think that's going to be a gradual the way we open up business. But no, employees, if your boss calls you and tells you got to go back to work, you got to go back to work.
When you mentioned the CARES Act funding regarding the rent and evictions, any idea when the state will be receiving that money, or maybe we've already received some of it, or when the cities can expect to receive those dollars?
We're working on all that right now. We've got a team of people working on it. My staff's working on that, and there's probably an answer for that, but I don't know right now as I stand in front of you. But I know there's still guidance coming in every day on how to spend this money, and money coming in all the time. So again, I just want to stress to you, we're really on the clock when that money comes in for whatever program it goes to. And if we got that in the guidelines, we're trying to get it out the door as soon as we can. And then I think all the websites we got set up, all the different entities that handle it are pretty well on a daily basis where you would know as a media. I think was yesterday or the day before, I think it was Kurt reported with the Post how the counties were going to be distributed the money there. And I think once that meeting was over, that was posted immediately. So all of that we're trying to put out there just as soon as we can. But that's what I know of it as of now.
Governor, some people in the St. Louis area heard you talk about surge testing at the meatpacking facility and wonder if in the St. Louis area there have been enough positive cases that surge testing is something that should be happening there.
Yeah, you know what, and I might have Dr. Williams follow up on this one, but we've been well aware of that the whole time. We put up a lot of mobile testing to St. Louis. We put more testing up there in that region. I think, too, the other thing when we say mobile testing, I think now it's to the point, too, that we can take testing to people that maybe don't have the ability to go to some of the test sites that we have around the state. And I think there's like 125 of those test sites now. But we also have the ability now to take that mobile to those areas where they don't have, maybe where they wouldn't have transportation to go. So I think all along we've been working with St. Louis region up there, making sure they got the supplies. And anytime they've called, as far as I know, Dr. Williams has showed up there, him and his team, to do that. But let me let Dr. Williams just address that a little bit. And if you have some other question for Dr. Williams.
Thank you very much for the question, and the answer is yes. As you may know, we are doing that this week around Missouri. We're doing 4,000 tests in 8 locations. We're in the 3rd Ward of Kansas City this week. We're getting our first results back from Sunday, and that St. Louis, I talked to Spring, and you may know Schmidt, who's head of the St. Louis County Health Department. They have put out an RFP to do 5,000 tests. To look at St. Louis County. There was some talk about the hospitals coming together and doing that for St. Louis City, but they wanted to do it regionally, and of course St. Louis County money has to be spent in St. Louis County. So texted yesterday with the mayor, Mayor Parson, and we very much are looking at going in as we have these other places now that we know the hospitals aren't going to do it, and doing that surge testing in St. Louis City, in areas in which we think we haven't as much robust testing, in areas of which we've established vulnerability. To the governor's point, we have opened up, it's either 6 or 8 mobile testing sites, or we haven't, but we've partnered. You know, to me, public health is at its best when we're a force multiplier, a military term, but we take our efforts and use it to multiply others. So we're incredibly appreciative to Fred in St. Louis City, to Spring and Emily in St. Louis County, to our FQHCs, Affinia and others. We've opened up a mobile testing site today where we go out and using Affinia as nurses, we test people who can't get into our mobile testing sites. So that's a long answer to your question, but the short answer is yes. We feel like St. Louis County is covered by Spring and her 5,000 tests. Just like we were in Kansas City, we are going to go into St. Louis City and do that as well.
Dr. Williams, with the box-in strategy for containing outbreaks in the future, given the delay between infection and when people start showing symptoms, how do you address that portion of it? How much time do you have once cases are identified to actually contain it?
Well, I'm going to use an example. We just sent out a press release at 2:30. Some of you may not have seen it, but I suspect if you'd seen it, you'd want to ask questions. So in Buchanan County right now, it's St. Joseph's. So we had our first case identified there 2 weeks ago tomorrow. And we were in there on Sunday night, I think it was on Monday. And so we have done 2,405 tests and are doing more today. We got our first tranche back from Monday today. So of 707 asymptomatic people, 92 were positive. Those are people who had been identified as not having fevers, not having symptoms. We're expecting another 917 to come back today. They'll come back overnight. And then we've got another 414 coming back tomorrow. So we are sending up today for these asymptomatic people, to your question, we are sending up a team of contact tracers to work with the local health department in St. Joe's. And we will immediately box in and go in, because these people are all asymptomatic. We've had a total now of 132 employees at Triumph test positive. Some of those were symptomatic, but the vast majority are asymptomatic. So in this case, we were on this within 2 days. We've identified 92 asymptomatic people already, and that gives us a tremendous power to go in and do contact tracing and isolate that. I cannot thank enough the employees for what they do. As the governor said, they are vital to our food chain. So we thank them for what they're doing, and we thank them incredibly for letting us test them. I think the testing rate, like I said, we've already done 2,430, I think, and there are only 2,800 employees. So we're incredibly appreciative to them to give us the information to help them. Can't say enough about Mosaic and Northwest and our elected officials up there. I've been in conversations with the mayor and the presiding county commissioner today. But going forward, we now have the testing capacity to move in very quickly to a site of we had 3,000 tests within 12 hours of needing them in Buchanan County. And that is a testament to the providers up there and our capacity. Yeah,
Would you recommend that meat plant be shut down?
I do not. Again, we are working with the CDC. We're working with our colleagues in Iowa. Iowa is really the thought leader in this. I'm on conversations with them frequently. We have a call into the CDC. At this point, you've got to remember the vast majority of these people are asymptomatic. We expect more to come back. If you look at our trend line, we think there will be more in the 917 tests that come back today and the 404, I think it is, tomorrow. But at this point, we will do what we do in public health, which is epidemiologically, contact tracing, isolating, quarantining, and identifying those. And so, again, cannot thank them enough. We think what they do is incredibly important. So all of us are able to go to the grocery store and get food. But clearly, our number one goal always is to protect the health and safety, and that's why we're in there doing 3,000 tests on asymptomatic people.
Dr. Williams, excuse me. Based on what you just answered, and also that the doors of businesses are reopening Monday, are you at the state level or our local health departments going to inspect these plants, inspect restaurants throughout the reopening process for their following the very rules that you laid out in a document just a few days ago?
Yeah, I think that's a great question. So we have a comprehensive testing strategy that we've put together at the governor's request going forward, now that we've moved out of the acute phase and the recovery phase. And so one thing we're looking at, again, our local health departments always inspect restaurants for the things you're talking about, but I think what you're really talking about is COVID-19, if I'm not mistaken, right? So as we look at our vulnerable populations, long-term care facilities, meat packing plants, certain areas, one thing we're very much in the process of doing is to look at what sentinel testing would look like and surveillance testing, where you would just go in periodically, similar to what kind of Iowa was doing with meatpacking plants, and just do type of preventative testing and looking at exactly what you're saying. So that's very much on our mind. We're looking at best practices across the country, and I would say that if you ask me that a month from now, we probably will, in fact, have implemented that.
I'm actually asking about adherence. If you laid out rules for what restaurants should do, spacing, protection,
I'm sorry.
adherence, even on the role of the meatpacking plants, because we're obviously workers reporting that they're not keeping distance, that they are having interaction, that they are exposed.
Well, that gets back to the point that, you know, they're like being a doctor, when I examine a patient, I have to be within 1 foot. So I can't be spaced in that situation. And we've made allowances for that so that you wear personal protective equipment, you pay attention to symptoms, you use hand sanitizer. So there will be businesses in which you cannot stay 6 feet apart. That's just the way it is. But as you know, part of our order on Monday, we recognize that and make sure that if you're going to be within that 6 feet, that you follow those other safety measures.
But how do you ensure that they will?
Well, again, I think, like so many things, people report violations when we regulate a lot of industries. And then for our local health departments, they will go in and do their normal inspections. And in our normal regulatory world, so much of what we do is based on people reporting people when they don't do what they're due, and then we investigate.
In a small town, I make press on this, but on a small town where businesses and everyone are, know each other, do you expect people to report? And those tests, those inspections, I understand, are annual. They might be biannual or annual.
Right.
But I'm not talking about when there's like you said, a major health issue. You know that there's one.
Yeah.
How can you ensure that they're going to follow your rules?
Well, I think as the governor has said, I think it's in the best interest of businesses to practice safe practices. I think for the vast majority of Missourians, they're not going to want to frequent or go to a place in which they think their safety is being put on risk. And as the governor said, COVID-19 will not disappear on Monday. So that if I was running a business, and I know the governor's been a small business owner, I would want to make, and I was, I guess, for a long time with my own practice, I would want to make sure that when patients came into my waiting room, there weren't 30 patients in a waiting room designed for 10, because I think they would say, wait a minute, this isn't safe. So much of this is based on businesses doing the right thing for the people who come to their businesses. But thank you.
Okay.
Governor, do you currently have any plan to get PPE to more people than just first responders and healthcare providers, but state workers, for example, especially prisons, psychiatric hospitals, those kinds of settings?
Well, I think the directors have to evaluate each one of their departments, but I think as we move forward, I think we all realize that PPE in different situations, people are going to want to wear it. So I think the market will bear that, and I think a lot of the businesses in the state of Missouri that have now geared up to make PPE or the face shields or the different items they're making, I think that'll go to the private sector. I can see that market picking up for a while. Especially, and I don't know which area, you could use the meat processing probably for one, that they should be able to use some sort of protections. You may see the salons, places like that where it's pretty close quarters that you may see that. But again, I think that's going to be driven by the private sector. But as we move forward, PPE gear is becoming more and more available. Now, we're still fighting that battle every day to get more and more in because we want to build up our stockpiles. But the first thing, I think your first responders and your hospitals are getting that under control now to a certain degree where they have a certain amount of cushion of days that they have. And then I think we're just going to build from that to where the private sector will go. But again, that's going to be private business. And I think that's going to be driven by the business owners, the employees, and the customers.
Are there places in the state budget that would allow, for example, the Department of Corrections to purchase N95 masks for employees? Or?
Yeah, look, I don't know what money's in the state budget other than I know there's 30-some-odd billion dollars in there, but I do know this: if we need to do anything to protect our employees in the state, we're going to protect our employees in the state. And if it's a matter of supplying PPE and we think that's the direction to go, we'll make sure and provide that at the state level. Let me make a comment on, a while ago, it was talking about testing again, and I just want to stress this point when Dr. Williams was up here. Monday we're going to open up the state, all across this state, to open up the businesses. All the testing procedures we're doing today, I want to make sure everybody's sure we're going to continue to do that, only we're going to be doing it on a larger scale as we ramp that up for that whole 30-day process. So when the question come up earlier about St. Louis, all of that we're going to track. Just because we're open up on Monday doesn't change anything to do with our model that we're using for the state of Missouri with the dashboards we're using. We're still going to collect that information every day so we really can get a good view of what's going on wherever you're at in the state of Missouri and know how to deal with that if we do have those hot spots. So.
There's been some confusion from residents who live in the Metro East regarding they live in Illinois and they work in Missouri. When Missouri opens up, which order should they listen to? The stay-at-home order in Illinois that was extended, or should they be coming to work?
Yeah, they should be coming to work. I'm not sure what the Illinois order is, but I would assume maybe they don't have any non-essential business, or maybe they're not working at all in that state. But if you got a job and you're in Missouri, and again, your owner calls you and says you need to come back to work, you need to come back to work. All right, thanks everybody again. Thank you.